Okay, my name is Luis Mora, and I'm going to talk about step-up therapy in Black children and adults with poorly controlled asthma. So, as a definition, we have that morbidity from asthma is disproportionately higher among Black patients than among white patients, and Black patients constitute the minority of participants in trials informing treatment. Data indicate that patients with inadequately controlled asthma benefit from addition of a long-acting beta agonist than from increased glucocorticoids. However, this data may not be informative for treatment in Black patients.
A new study suggests that differences in airway inflammation may be one reason why Black people suffering from asthma are less responsive to treatments and therefore more likely to die from the disease than white people. The study's corresponding author, Dr. Charmaline Ninehouse, said, "Emerging evidence suggests that differences in airway inflammation can affect a patient's response to treatment, but whether the patterns of airway inflammation vary across race has, until now, been very unclear." The study found that even with similar doses of asthma medications, Black patients were more likely than white patients to have what is known as eosinophilic airway inflammation.
The applications in medicine, two prospective randomized double-blind trials were made, one involving children and the other involving adolescents and adults. In both trials, the patients had at least one grandparent who identified as Black and had asthma, but was inadequately controlled with low-dose inhaled glucocorticoids. They compared combinations of therapy which included the addition of LABA to an inhaled glucocorticoid, a step up to double to quintuple the dose of fluticasone or both.
According to a new study, African American children who experience discrimination are at a greater risk of having asthma. 1 in 10 children in the United States have asthma, but the condition disproportionately affects African American and Latino children more than white children. Dr. Louisa N. Borrell said in a press release, "Discrimination is a common and everyday experience for minority populations in America. People can be exposed to it at the individual and society levels. This constant stress gets embodied into our biology or DNA to change our body's responses to disease and medical treatments. Our findings support this biological embodiment for asthma and its control among African American children and among low SES, socioeconomic status Mexican American children."
As pros and cons, pros adding salmeterol and doubling the fluticasone caused a superior response in 46% of the children. More adolescents and adults had superior response to added salmeterol than to an increase in fluticasone. Cons, neither the degree of African ancestry nor baseline biomarkers predicted a superior response to specific treatments.
Yes, Black human seeds can help with asthma. Asthma occurs when someone's bronchial tubes get inflamed, tightened due to their muscles, and mucus builds up, which restricts breathing. This occurs due to something known as triggers, which can be a wide variety of things. For example, like the weather, emotions, the immune system, and even, of course, breathing in something like a chemical or pollen or something. Now, one of the ways Black human seeds can help is it reduces inflammation, and this helps with someone's breathing. Inflammation is basically when the body attacks itself, gets inflamed, red. Another way is it reduces free radical damage, and of course may even reverse damage done by them, which of course helps with somebody's breathing. Thirdly, it has something known as histamines. When someone has an allergic reaction, these histamine stuff gets released by the body. Now, one of the main nutrients in Black human seeds is known for stopping histamine release and therefore preventing allergic reactions. Now, there really are just an insane amount of medical conditions that black human seeds can help with, which is why I take them. I do that in supplemental form, mostly because it's easy and convenient. Now, there's a lot of great products out there in the marketplace, and of course some are not that good. To help you with your shopping, because I know with space it can be kind of confusing, I actually created a guide that will explain what to look for and what to avoid in a product. Various herbs and even dosage amounts. Oh, and it's completely free, and it's not like some big sales pitch. No products are being mentioned in the guide. So check it out. Let me know what you think by simply clicking on the link right below this video, and I hope you enjoy it.
Issue applied in Ecuador. In Ecuador, there were reported 1,489 cases of children who died from asthma in the past year. From these patients, 70% were registered to be black children.
And we're going to go over asthma. So this is an inflammatory disorder of the airways. You're going to have some coughing, and that's going to worsen at night. Pronounced wheezing, dyspnea, tachypnea, and chest tightness. To diagnose this, we're going to do a pulmonary function test, and then treatment is to avoid the substances that trigger the symptoms, whatever that may be, and then to control airway inflammation.
And in conclusion, in contrast to black adolescents and adults, almost half the black children with poorly controlled asthma had a superior response to an increase in dose of an inhaled glucocorticoid, and almost half had a superior response to the addition of a LABA.
Hi, I'm Dr. Rena Ziadeh. When it comes to taking care of asthma, there are 3 things that are very important. Always have your medicines on hand. Know how to use your medicines to control your asthma symptoms. Know how and when to get help when you need it. Working with you as a team, we at Children's Hospital of Pittsburgh and Children's Community Pediatrics can help you keep your asthma under control. Here's more information about what asthma looks and feels like from asthma specialist Alvin Singh.
If you're going to try to control your asthma, it's very important that you know what asthma is and what it looks and feels like. So let's talk about what happens when you breathe. You breathe air in through your mouth or nose, it goes down your windpipe or trachea, and then to your lungs through various sized airways. In asthma, a trigger of some sort causes the airways to become inflamed, swollen, and filled with mucus. This causes obstruction of the airways, which makes it harder to get air in and out of the lungs. Your chest might feel very tight, as if someone is sitting on it. You may cough a lot and also have trouble keeping up with your friends during sports or other activities. You may also notice a whistling sound when you breathe, which is also called a wheeze. These symptoms can occur during the day or at night. Some people who have an asthma attack say it's like trying to breathe through a straw. Other symptoms include rapid breathing, breathing with the shoulders, and flaring of the nostrils. Smaller children can have rapid breathing as well, which can sometimes cause the skin around the neck and the ribs to be sucked in. Any child can have the symptoms described above with a cold. But if the same symptoms keep coming back more frequently, you should think of asthma as a possible diagnosis and see your pediatrician. Asthma can be brought on and made worse by different things. Allergies, which are accompanied by sneezing and runny nose, can also make asthma worse. Seasonal allergies can also make asthma worse depending on the time of year. Various allergens, such as dust, grass, ragweed, and mold, can make asthma worse. Other triggers, such as changes in weather, crying or laughing very hard, and the common cold, can make asthma worse as well.
Hi, I'm Linda Earhart with the American Lung Association, Program Manager for Pennsylvania Asthma Partnership. I hope you found these videos helpful. For more information on how to stay healthy and gain control of your asthma, you can visit these websites.